All right, let's get straight into it. We've got an important public health update to talk about today, avian influenza, or what most of us just call bird flu. We're going to walk through the official communications so you know exactly what's going on and, more importantly, what it means for you. Okay, so here it is, the official memo itself. You can see the date, February 5th, 2026. This document from the Director of Public Health confirms that the H5N1 virus has been found in crow samples. So let's be clear, this isn't just a rumor or some speculation. This is a confirmed thing, and it's already set a whole public health response in motion. So a confirmation like this lands. What does that actually mean? In this first part, we're going to cut through the noise and get straight to the facts, exactly as they've been laid out. Let's just break this down real simple. The what? We're talking about the H5N1 strain of avian influenza. The where? This was confirmed in Kanchipuram from samples taken from crows. The who? The Directorate of Public Health is the one communicating this, so it's official. And, the most important part, the why. It's all about getting ahead of this thing, kicking preventative measures into gear, and making sure all of us are aware of what's happening. Okay, so we've got the who, what, and where. But what exactly is this virus we're dealing with? Let's take a closer look at avian influenza itself. So at its core, avian influenza is a viral disease. And yeah, the name kind of gives it away. It mainly affects birds, both poultry on farms and wild birds. But the real reason public health agencies watch this strain so closely, the reason we're even talking about it, is because it has the potential to jump from birds to people. That's what scientists call a zoonotic transmission, and it's a big deal. So if we get a little more specific, the virus we're talking about is an influenza A virus, type H5N1. Now, birds are its natural home, right? But transmission to humans, well, that usually happens through direct contact. We're talking about things like handling infected poultry or coming into contact with their blood, organs, or other bodily fluids. And yeah, just like the regular flu, it can also spread through respiratory droplets. Understanding the science is one thing, but what does this actually look like in people? This next part is super important. It's all about how to recognize the signs and symptoms if someone gets infected. And this is probably the question on your mind, right? How would you even know if you were infected? What should you be looking for? Well, the official guidelines actually give us a pretty clear picture. Okay, so the incubation period, that's the time between when you're exposed and when you first feel sick, is usually about 2 to 5 days, but it can stretch out even longer. And at first, the symptoms look a lot like a really bad flu, a fever, a cough, sore throat, all those muscle and body aches. But here's where it gets serious. The real danger is when it progresses to severe symptoms, like shortness of breath or difficulty breathing, pneumonia, and even something you might not expect, eye redness or conjunctivitis. All right, so we've covered what the virus is and we've talked about the symptoms. Now let's get to what I think is the most crucial part, what you can actually do to protect yourself. Because knowing about it is great, but taking action is what really keeps us all safe. Let's start with what are called universal precautions. Honestly, this is stuff we should all be doing anyway, but it's extra important now. First up, and you've heard it a million times, wash your hands, soap and water. Do it often. Second, cover your coughs and sneezes. Third, try really hard not to touch your face, your eyes, nose, and mouth. And a couple of other things that have become second nature to us lately. Keep that social distance. Try to avoid really crowded places. And please, don't just start taking medicine on your own. If you feel sick, you need to get professional medical advice. Now, beyond the general stuff, there are some very specific things to keep in mind for this particular situation. Let's start with the do nots, because these are critical. Do not have any unprotected contact with sick or dead birds. And do not eat any poultry, meat, or eggs that's raw or not cooked all the way through. Now for the do's. If you see any unusual bird deaths, report it immediately to the Animal Husbandry Department. If you absolutely have to handle a dead bird, you have to wear gloves and then wash your hands like crazy afterward. And of course, if you start feeling any of those flu-like symptoms we talked about, get medical advice right away. Don't wait. Okay, so while all those individual actions are our first line of defense, it's good to know there's also a big coordinated public health response happening in the background. So let's take a look at how the authorities are actually managing this whole situation. And this is really important to understand. This isn't some chaotic scramble to figure it out situation. There is a very clear, well-defined protocol already in place. The health authorities are not starting from zero here. They have a solid plan to manage cases and contain the spread. And this plan is actually based on a person's level of risk. So, for example, a healthcare worker who's wearing all the proper protective gear, they're considered low risk, no preventative medicine needed. But say someone has direct, unprotected exposure to sick birds. Well, they're at moderate risk, and the recommendation is for them to take a preventative antiviral drug like oseltamivir. And it's the same for high-risk folks, like someone living in the same house as a confirmed patient. So what does this look like on the ground? Well, first, rapid response teams are being trained up. Hospitals are on high alert, enhancing their surveillance for any flu-like illnesses. They're also closely monitoring poultry workers and anyone else who has close contact with birds. And if it's needed, they're prepared for culling operations to stop the virus from spreading among birds. And absolutely critically, they're making sure that PPE, personal protective equipment, is available where it's needed. So if you need more information, or if you're worried about symptoms for yourself or someone else, this is the number you need to know. It's 104. That's the Public Health Helpline, a direct line to get official information and help. You know, in any situation like this, rumors and misinformation can spread just as fast as any virus, and they can be just as dangerous. The official advice here is really simple and direct. Avoid the rumors. Stick to official sources for your information. And maybe the most important thing is that you can play an active role in this. Reporting any unusual sickness or death in birds is absolutely essential. It helps the authorities track what's going on and contain it. So when you boil it all down, here's the crucial point. The authorities have a plan, but it only really works with our help. Your awareness and your cooperation, that's truly the first line of defense. So stay informed with the right information, and please stay safe.